Welcome to On the Pen Live. I'm your host, Dave Knapp, ManOnMounjaro. That's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Mounjaro, Zepbound, Compound. For the time being, that pen. That's why you are here. And welcome to a extremely exciting edition of On the Pen Live. We've got Zachariah Reitano from Ro tonight, here to share about their latest tool that they're offering for the community, and we're super excited about that. So good to have you all here. Welcome, Pete. Welcome, Max, DJ, Ray, Sue the Dude. Good to have you in here, buddy. Allie. Who else we got? Sandra, J Neb, Brent Tuggle, Rudy. Welcome. Good to have you all here. Thank you for being here. We've got a packed show tonight. So much to talk about in the world of GLP-1s. But before we get into the news, you know, we've got a rhythm and a reason and a rhyme to this show. So we are going to do a little housekeeping. Housekeeping. What a week in the world of On the Pen. You have got to make sure that you are over there at OnThePen.com following all the updates, all the alerts. There has been so much news this week. And if you missed out from On the Pen website this week, you missed out on a whole lot. Of course, we've been covering wall to wall the story about the cease and desist letters from Eli Lilly that we'll get into a little bit later on, but you would have heard all of that first over the weekend, last weekend, if you followed OnThePen.com. So make sure you jump over there, sign up for email alerts, because even if you miss an article that gets posted here or there, we're going to send it to you in your inbox early on in the week. So make sure you get over there and check that out. Of course, we've been talking for the last couple weeks about, who knows what I'm going to say next. Drop the emoji in the chat if you know what I'm going to say next. Of course, we've been talking about On the GLP-1 Pen book that is getting so close to being done. The manuscript is done. It's just a lot of the busy work that has to happen at the end of writing a book that I've learned is really the hard part of writing a book. So we will be releasing this book here, let's call it in the next few weeks. So you have to make sure that you jump over to OnThePen.com and sign up for email alerts. You'll be the first to know when that book drops. Super, super, super excited to share that. Again, the heart and soul behind that book is that you would get that book in your hands and read through it yourself and pass it on to a loved one who you want to understand more about what it's like to live in a body with obesity, with type 2 diabetes, and to understand more about the medications that are absolutely leveling the playing field and changing the game for those of us who live with those chronic diseases. So super excited for that. Make sure you sign up for email alerts so you know what's going on there. And we are going to keep this thing rolling because there's so much to get into in the world of GLP-1 news this week. We're going to get into what's fresh for the week. So what's fresh this week? Well, actually, I've got a cool video to share. And, you know, you may have seen the Fortune magazine article that dropped just a couple of weeks ago. And I've been waiting to get this thing in my hands so that I can do something I've had in mind to do for the last, the last month or so, ever since this happened. It's one of those big things in life where you just have to step back and you have to just kind of appreciate the moment for what it is. A guy who was diagnosed with type 2 diabetes, making websites for companies, selling portable stoplights a year and a half ago. And I just started making videos about the medicine I was on and learning about them and sharing information. And literally 18 months later, we have articles in health.com, Health Magazine. We've got articles in Bloomberg and in Seeking Alpha and now Fortune Magazine. And so you sort of just have to step back and go, okay, let's just breathe here and acknowledge that we're doing something really cool. And so one of the things that I've always liked to do when I have sort of like a big moment in life, right, is I like to just go to my dad's grave. And this time I decided I was going to share that experience with my kids. And I just want to share that experience with you. It's sweet and it's funny and it's all the things. So let's watch this together. So what we're going to do, guys, is we're going to go into Barnes & Noble. We're going to buy a copy of the magazine that Daddy was in. And then we're going to go to my daddy's grave and just leave this there with him, just kind of because it's a cool thing that daddy got to do this. And this would have been something that I would have wanted to share with him. So you guys want to come with me to do that?
Yeah.
All right.
It's going to be cool.
Yeah. All right. Let's go see if they have it here. Okay.
Yeah.
All right.
Daddy's
See if they have it. Okay, so this was our third trip to Barnes & Noble and our third time striking out. They still don't have, we're August 15th, and they still don't have the Fortune magazine for August, September. So step your game up, Barnes & Noble. All right, so we'll go home. We'll grab a copy that Fortune sent us, and we'll take one of those. You guys want to do that?
Yeah.
All right, let's do it. Now we got it, guys. You guys ready?
Yeah.
All right, let's roll. So we're almost there, guys. So the reason that I wanted to do this is just because sometimes in life, there's just some things that you enjoy doing with your daddy. Do you guys enjoy doing anything with your daddy?
Yeah.
Like what?
Cuddling to the falls.
Cuddling, going swimming.
Mm-hmm.
What else?
Spending time with you.
Spending time, going to the camper. So all those things are special things that we get to do and spend time together with, right?
Yeah.
So then we have big life things happen sometimes that you also like your daddy to be there for, your ball games and school things, programs and stuff. When you get older, it's no different. You want to do things with your daddy when you accomplish big things. And so when OnThePen got basically acknowledged in this magazine that millions of people will read, that's a big thing that I wish my daddy was around for. He's been gone for 12 years now. And one of the things that I wish he would have got to see was all four of you being born and all the things that you guys have accomplished. But this was one thing that daddy has accomplished that I wish that my daddy would have seen. So we're just going to symbolically go take this to his grave, because I just like to do that sometimes when I have big thing in life happen. I just like to come here. And there's lots of people out here. Lots. Some that mommy and daddy even know. So we'll go do this real quick, okay, guys?
Yeah. And can we see Red Eyes one?
We could.
Can we, Dad?
You could.
Where are we going?
Right over here, guys.
That's okay.
Right here.
Whose grave is it?
This is Papa Ronnie's.
This is Papa Ronnie's grave.
Yeah.
Papa Ronnie's under this.
So what do you?
He died on the day after my birthday. Guess I forgot.
Isn't that cool? I mean, it's cool how God does those things, with timings and dates. Just reminds you that He's in control, right?
That's basically littering, though.
No, I'm not gonna leave it there. So what do you guys think Papa Ronnie would say about this?
He would be really proud of you. He'd read it.
Yeah.
Are these underneath the ground dead, Benny? He's a bonehead. No, he's not. No, I'm just kidding. I'm just kidding, Benny. Imagine he pops up and says, turn into a skeleton, right, Dad? Soon.
Yeah.
Benny, he could be a skeleton. No, Benny. Yeah. So, you said, Cooper, you said these are fake flags.
That was such a sweet moment with my kids. Funny too. I don't know if you caught it. My daughter there, she says at one point, she says, "What if he pops out of the ground and says booga booga booga?" She's 6, by the way. Yeah, so definitely, I don't know how much y'all could catch in there, but there were definitely some lighthearted moments in there where the kids are, adding kid commentary. So I wanted to show that to y'all tonight. But yeah, this was a huge moment in OnThePen history, right? And we're doing exciting things together. Obviously, last week we celebrated the release of the single dose vials, which felt bittersweet because it was followed up immediately with, really concern and stress on the part of people who I'll rely on compounded versions of tirzepatide to maintain access to the medication. But of course, one of the things that we've always fought for here at OnThePen is accessibility. And we would love nothing more for there to be ample medicine going around. And ample branded medication is a huge part of that picture, right? And so a lot of what's going on right now, so to kind of get into the news of this week, is you saw Eli Lilly send out cease and desist letters last week to multiple entities, right? Some smaller telehealth companies. You saw them send them out to med spas and even some providers, which to me, that was the hard one to wrap my head around with providers, because providers prescribe medications to prolong people's life, to improve their health, to do all these things. And so if they write a prescription for something to then have a pharmaceutical company go after them, that one is really hard for me to get my head around. But we've been following this very closely. Obviously, it's not a fun or exciting topic to talk about, but we've been following it close because we definitely believe in something around here. And we say it often that we want to equip you at OnThePen to have more competent and confident conversations with your medical care team. And that includes being educated on what's going on in the world when it comes to these medications. Not only what's going on with the shortages, but what's going on with medications that are in the pipeline that may benefit you in the future. We want to equip you with information here. And that is one of the main things that we exist to do here at OnThePen. So thank you for being a part of this story as it all unfolds. I'm here because you're here. I'm here because you encourage me to be here, because you do all the things that a good audience does. You interact, you like, subscribe, you comment, you encourage, you email, you do all the things that give me that extra push to continue doing what we do at OnThePen. And so we're doing this together. We got Release the Vials together. The next thing that we need to really focus our energy on is improving access to these medications by way of our insurance plans. And one of the big things that we can do in that process is we can advocate with our employers to add obesity coverage to their plans. And so that is why one of the things that we have launched this past week was the OptIn For Obesity campaign. And so if you go to onthepen.com, there is an article, and with that article comes a form letter that you can download and just basically put your information into that Word document and submit that to your employer. In larger companies, you may have a benefits coordinator. In smaller companies, you may have an HR person, and it may even be your owner. But this is one way you can advocate for the future of health insurance coverage. One of the things that I want to encourage you is to start having these conversations now, because these plans for next year, even if your insurance rolls over the first of the year, some it's maybe the start of the second quarter. It's different in different businesses, but right now, by and large, these decisions are being made. These discussions are being had. And so you want to really encourage your employer to add obesity coverage so that you can get access to branded medications, so that hopefully we don't have to ride this roller coaster of will compounds be available. It'll just be enough medication to go around. And of course, we would love to see more competition hit the market so that prices are driven down and they become more accessible in that way as well. We would love to see Eli Lilly put something together for our friends, especially our friends on Medicare, right? Because I think our friends on Medicare are the ones that really are left out, right? They don't get access to obesity medicines. And even if they are prescribed that, they don't get to use these savings cards from the manufacturer. So I have a special tender spot in my heart for those on Medicare. They already have it so hard. And it's such a tricky thing to navigate. So I hope to see action done in that regard as well. Of course, we saw the Treat and Reduce Obesity Act pass Congress, but unfortunately, the version that was passed is pretty insignificant. I mean, to be totally honest with you, I'd hate to rain on anybody's parade, but ultimately, the way that left Congress was that for those who are on obesity medicines for at least a year prior to getting on Medicare Part D plans, that Medicare will continue those plans for those people. But for those who are already on Medicare, the Treat and Reduce Obesity Act, as it's written currently, is not going to do anything for you. And so that's obviously very frustrating. Thankfully, to not be all doom and gloom, Novo Nordisk and Eli Lilly were hedging against TROA not being exactly what we want or need it to be. And they've got these backdoor indications. Obviously, we saw the select trials for Wegovy. Wegovy was added to Part D formularies for people with heart failure. We have seen now successful sleep apnea trials for tirzepatide. We've seen a successful heart failure study for tirzepatide. And later this year, we expect to see an osteoarthritis study for tirzepatide. All three of those indications by next year will likely be backdoor ways to getting tirzepatide if you're not diabetic on Medicare. So there are going to be some backdoor ways. You know, you think about people who are on Medicare age, they're the people who have lived with the disease the longest by and large, and they suffer from more of these comorbidities. And so those are really, I mean, I feel like we spend a lot of time, especially over the last week, coming after and coming down on these pharmaceutical companies who really invested billions of dollars to bring these drugs to market, which were not a slam dunk, right? Because insurance companies haven't traditionally covered this. They've traditionally seen this as a cosmetic issue and not a metabolic disease issue. And so they really gambled on these drugs to bring them to market. And I'm so thankful that they did. And I'm also so thankful that they had the foresight for our friends on Medicare to put the money into these trials that will ultimately, like I say, be backdoor ways into getting Medicare coverage. So it's not all doom and gloom for our friends on Medicare. And I'm so thankful that we're seeing, some options come to market for our friends on Medicare. So OptIn for Obesity, that's the new hashtag campaign. We're going to work with our employers. I realize that not every employer is created equal. Not every employer will have the ability to do this, but maybe there's some out-of-the-box solutions in there. Maybe you can talk, when it comes to arbitrating your salary, if you have those kinds of discussions, just bringing it up into conversation, because I think there are benefits, and some of those are laid out in that employee form letter to your employer about, the increase in productivity for patients who get treatment for their metabolic disease, and over the long term, a reduction in overall medical costs over the course of a lifetime. So this is where our efforts are going to be focused moving forward. Of course, you cannot start advocating for your employer to add obesity coverage if you don't know where you stand. And that sort of brings me to our guest tonight, and sort of a natural fit. Zachariah Reitano is the CEO and co-founder of Ro. Now, if you're not familiar with Ro is a telemedicine juggernaut in the United States here. They were really a forerunner for a lot of the telemedicine companies that you see out there now. And of course, they have an amazing program called the Ro Body Program, where patients are able to get access to providers who can put them on a lifestyle regimen of dietary changes and movement, and couple that when necessary with medication that can help some patients lose up to 10 to 15% of their body weight, in some cases even more. That's the Ro Body Program. You can find that at ro.co. Of course, they're a sponsor of OnThePen now, and they have an amazing tool that they are rolling out this week. Maybe you've heard of it, but no one better to talk about this program than the man himself, which is Zachariah Reitano. He's here to talk about it tonight. He's tonight's Hot Channel.
Hot Channel.
Z, welcome back.
How's it going? Thanks for having me back. I have to tell you, I just had such a big smile on my face watching you and the kids. It was pretty heartwarming. It was pretty incredible. That's a really nice thing that you did there. And I grew up with my dad. He would always try to cherish the present and, create those memories. And they did stick with me as a kid. So I'm confident that they'll stick with your kids. And that's just really sweet that you did that.
Yeah, I've been rattling this day around in my head for a long time, and I finally had the opportunity to do it today. And so it was great to just kind of share that moment with them. Also fun, they're always teaching moments whenever you have little kids and, you take them to a funeral or you're at a grave and you're sort of having these big conversations about mortality and life and death and just big things. And it's just so sweet to watch them sort of process through it all and learn it. And I don't know, there's some really funny things in there. Y'all will have to go back and watch it if you miss it. But some of it, they said some funny stuff in there. But really appreciate that, those kind words, and really appreciate the amazing tools that you and your team over at Ro have come up with. First, the supply tracker, which I think has been wildly successful, right? Tell us a little bit about, since that launch, tell us a little bit about what insights have you gleaned and how are people still using it and finding value?
Yeah, we still get tens of thousands of shortage reports a month. So people are still finding, I think, tremendous value in the tool. It's sort of bittersweet in the sense that it's awesome to build free tools that help make people's lives easier, but it's bitter to see all of the shortage reports across the country. About 2 weeks ago, we were able to share those shortage reports with the FDA. So we shared over just about 60,000 shortage reports in 2 weeks, 2 months with the FDA. So we were able to share with them a lot of the data that patients obviously give us permission to share with them. Drug dose, zip code level, drug dose and zip code all across the country to hopefully give them like boots on the ground of lived patient experiences. We did see probably about 40% were for Zepbound, another 40% were for Wegovy, and then another 20% were Ozempic, Mounjaro, Victoza, Saxenda combined. But the vast majority, about 80%, were just Zepbound and Wegovy, and mostly the initial doses. But it's been it's unfortunate, but yeah, the tool has continued to grow in usage.
And you do continue and will continue to report those to the FDA, correct?
Yep. Yeah, absolutely. We're gonna keep updating them. And again, and you've talked about this right now that they're very receptive to it, right? Because traditionally they've primarily been able to get data through conversations with pharma companies. And what we're trying to do is boots on the ground, show them and share with them the lived experience that patients have in real time. Because there does seem to be, and I think, there does seem to be a mismatch between the list and our patient's experience. Right now, and the both semaglutide and tirzepatide are currently listed on the FDA's website is currently in shortage, even though the doses themselves are listed as available, and we see that. So the majority of patients, when a script is written on the Ro platform for Zepbound and Wegovy, the majority of patients are not able to pick up their medication within 14 days. Again, this is national averages across the country. It starts to get better at day 20, 25, and 30. And we see pharmacies on back order. And then you even heard Lilly themselves in their earnings call talk about, the pharmacy experience was going to be choppy. So, there's definitely, and Natalie comments, there's a mismatch between what they say in reality. And so I think we see, hopefully more and more supply comes online. I think releasing the vials, as you said, is sort of a bittersweet thing because hopefully, patients will still be able to maintain access. But I can tell you that patients across the country, it's not easy for them to find supply right now.
Right. And obviously we've done our due diligence here going back a year to explain to people that the FDA shortage list was always a report given by pharmaceutical companies on sort of a voluntary basis to the FDA on their ability to fulfill distributor orders, right? And that all seems like there could be a lot of conversations between distributors and pharmaceutical companies. Like it's not super black and white, right? But I think what we've been talking about here is another hashtag that we've used. Drop it in the comments if you know what I'm talking about. We've used the hashtag report the shortage because the Lilly and Novo Nordisk are obviously going to tell their story to the FDA. It is so important that we continue to tell ours as well, from the patient side. And so whether you're using the Ro tool, which is really great because there's sort of a value add, right? You're gonna report your shortage, but then you're gonna go and report when you find it. And when you do that, it's sort of this crowdsourcing of, hey, you're going to get an alert in your inbox when the medicine is around your area. So you're going to know when it's back in stock to go sort of hunting around for it. So there's that value add. Of course, we've always been able to go to the website of the FDA and report that ourselves. So there's sort of two ways to do it. The FDA website is not super user friendly, though. The Ro website, very, very easy to use.
So we also asked for the zip code. Again, to help the FDA see, because right now the FDA, there's a text box, right, where people can add, but what we're trying to do is create incredible consistency for the FDA so that they can see it by state, by zip code, by dose, so that they see the shortages throughout the country.
Yeah. And just to kind of run everybody through that, it's a very easy to use website, super easy to navigate. I can't find it. I found it. Right. And then below there, you can sort of see where all of the medications currently stand. Obviously, at a glance, I love what you've done with the emojis. Just sort of very easy because our eyes are sort of trained to react to those. So like very smart on your part. So great. I'm glad to hear that. I know that our OnThePen community has been hashtag reporting the shortage for sure. And your tool has been a great tool for the community, which all sort of sets the stage for your next project. So why don't you lay it on us and tell us what you've been working on and what you launched this week?
Yeah, we launched, we're super excited about it because we think it helps solve one of the biggest pain points for patients. But the tool that we launched this week is the Ro GLP-1 Insurance Checker. And basically what it does, and this community will know it all too well, is it helps people at the very, very beginning of their journey understand their insurance coverage. So it'll break down whether or not they're covered, whether or not they need a prior authorization, what their estimated copay is. We'll layer on FDA availability data as well, and then we'll help them with the potential best next steps. And we built the tool to be able to both, if someone at the end of their results wants to use Ro, they're more than welcome to do that, of course, but we also built the tool for them to be able to publicly share this with their doctor very easily. We give them tips about how to communicate with their doctor about their coverage, right? So even sentences of saying, tell your doctor that you called your insurance company, that you're covered, that it requires a prior auth, but you think because of X, Y, or Z reasons that it'll be covered. So we're really just trying to build free tools to empower patients here. The why behind it, again, many people here are going to be familiar with it, but we've done tens of thousands of benefits verifications across the country to help patients understand. And the challenge is that right now there's either the burden to understand is so significant, either a patient has to spend 45 minutes to an hour on the phone with their insurance company and have to go to the doctor, or they show up at the pharmacy and get surprised by their coverage. So the unknown or the burden of figuring that out leads to a lot of people not even seeking care in the first place. So first is there's a tremendous gap, as you called out, between coverage, knowledge, and access. And then the second thing that we see happens is even if someone is able to pursue care and builds up that courage and goes through that friction, a lot of doctors' offices are tremendously backed up and overburdened. And that burden of those prior auths or benefit verification might be so prohibitive, or even if the patient takes that step, they still might not be able to see if they're covered and break that down across every single drug in an easy and digestible way. And we have patients come to us all the time and say, my doctor, they didn't even want to check because they've heard that it's so hard or that coverage is limited. So they didn't even check in the first place. And to us, that's, yes, a lot of people aren't covered, but to us, that's so sad to hear because, tens of millions of people are covered. And the difference between being covered and not is, we see our average payment when someone's covered about $50 a month. And if you're not covered, it could be, if it's compounded, let's say it's a couple $100. And if it's branded, it's $1,000 a month. So the difference could be $50 a month to $1,000, $500 a year, $600 a year to potentially $12,000, just if someone knew if they were covered. So we really, for us, this is about, again, bridging that gap between coverage, knowledge, and access, trying to help people at the very beginning of their journey for free. Just say, is insurance, am I covered? And can I pursue insurance? or do I need to look at alternatives without ever leaving their home? Takes 5 minutes, and then hopefully they can figure out the best next steps for them. We can. I'm happy to also. I can find an example report if it would be helpful for people. David.
Yeah, I was just trying to find mine here too in my inbox. I should have had that on deck here.
But pop yours in the chat or no?
Yeah. Go ahead.
All right.
Yeah.
So this is an example report for people. Oh, this comment failed to post. Oh, maybe it's a link thing.
Yeah, if you drop it in the private chat here on StreamYard, maybe that'll work.
All right. I'll pop it in the private chat, and you could probably pop it in the comments for people.
Yep. So we'll hold that up.
Yeah, so that makes sense that you don't get bombarded with links in the comments.
So while I pull this up, Z, a little bit of the pushback that I've heard on the tool, and just
I love it. Let's hear it. It's always good feedback. Last time we added Victoza because of this group, so I'd love any feedback.
Yeah, great. So one of the things that I hear often is, well, I can just call my insurance company. What's your retort to that?
So my first is you can, of course, you can call your insurance company, but you're busy, And for us, for me, if someone wants to call their insurance company, it's probably going to take 30 minutes to an hour. They can take 5 minutes. We'll do it for them for free. And we'll put together a really great report. So one, I think that we save people a tremendous amount of time. There's always people could do that. And if they want to do that, they can. The second is because we've done this, close to 100,000 times at this point, we have a real, Tay hates phone calls. So I appreciate that, Tay. It's a lot easier. So first is you could also go to the store, or you can order it online. Some people like to go to the store. If you like talking to your insurance company, you can go do it.
Right.
But if you don't want to, we're happy to do it. The second thing is it's more, I think, than just time. I think that we put together a really personalized report and break down each component for people. So if you scroll down here, Dave, here's a perfect example. We're breaking down the coverage, breaking down the copay, supply availability across multiple drugs. We're getting also, the average, the people who aren't used to talking to insurance companies, they might not know exactly what questions to ask in the exact way that the representative needs to hear to pull all of the data that's useful. The next thing, actually, if you scroll down and click read full breakdown next to Ozempic, and this is, if you scroll up a little bit, read full breakdown. So if you scroll down here, this is another thing. Again, it's more than a phone call. Here's a perfect example. We're taking that patient's copay, and we're trying to help them see and translate a lot of the typical parts of the healthcare system, which is if your deductible is $2,000, let's say you haven't used it yet, it's the beginning of the year. A lot of people are confused between their deductible, their copay, how much they'll actually have to pay. They show up to the pharmacy, $1,100. They thought my copay was $50. So trying to show them, yes, it'll be $1,100, then $950, then your copay is going to kick in. So there's a bunch in our mind, which is, yes, there's the time, but there's us of trying to translate a lot of healthcare and insurance language. And you and I have talked about this. What you do here, you've translated Lily's earnings calls in many ways to that patient-centric, patient-friendly, digestible language. And I think for here, we can translate this phone call. We can translate your coverage plan, and we can translate hopefully in a really digestible way for you and for your doctor, right? So we're going to be able to you're going to be able to just take this link and send it to your doctor. So if people want to call their insurance company, want to spend an hour, they want to translate, they can do that. But hopefully if people want to do this for free and then send this to their doctor or give Ro a shot, they can do that as well.
There are a lot of things I would rather do than be on the phone with my insurance company.
That's right.
Root canal,
us too.
Mastectomy, you name it. I would rather do it than spend any time on the phone with my insurance company. Good Lord. But the other thing is, and Z pointed out, you're not going to get this level of at a glance understanding of it. And what I love that maybe my favorite part of what you've done here, Z, is of course it's all beautiful because everything Ro puts out is just stunning from a user interface standpoint. But one of the things that you've done is you've layered on the GLP supply report tool, and that data is in here. So I can see right here, there's low supply of Wegovy, there's inconsistent supply of Ozempic, inconsistent supply of Zepbound. Of course, you've got compounded semaglutide in stock through Ro. And then it's just super simple. If you want to take this, print it off, take it to your doctor. and sort of, again, because their doctors are a lot of things. They're not experts in your insurance. Each one of their patients comes in with a different plan, different deductibles, different this, different formulary. You take this in, you hand it to them. Say, see, doc, I've got coverage. Ro says it's available. Let's get this thing done. It's just, again, what I love about it is so complimentary of everything we try to do at OnThePen. It's empowering you to have more competent, and confident conversations with your doctor and just be informed. And so that's amazing. So really great. So like, obviously you see, to kind of bring this back to how important it is to advocate with your employer for coverage. The start for many people, I realize that's not going to be everybody or many people here in the chat tonight because we're all OGs. We've been on the medication for a while, but how nice would it have been for you to have this tool at the beginning of your journey, right? To have this at the beginning. So it's definitely something to share with your friends who are interested in getting on the medication for sure. But when we talk about advocating with your employer, the first step is knowing, do you have it or do you not? And this is a super easy way to just plug it in there, see if you do have it or you don't have it. Of course, I don't have it. It's very obvious. Wegovy, Zepbound, the obesity management versions of semaglutide, tirzepatide are not covered by my insurance plan because I am diabetic. Ozempic is obviously an option for me. So are there any plans to add Mounjaro? Just out of curiosity.
Yeah, we're always looking to add. I think as more and more comes on, right? There's Saxenda, there's Mounjaro. Depending on, we'll see what coverage rates for Rybelsus. Hopefully, if more and more medications come out, we can always add them. These were when we were building. These are the ones that we also have the most historical data on, because Mounjaro's supply was so limited that it wasn't something that we had a lot of historical data on. But we're always looking to add more and more to the formulary.
Yeah, and obviously, most people are coming for the obesity management versions.
That's right. That's right.
So that makes a lot of sense.
And usually, not always, but usually if you're covered for Ozempic, you're very likely to be covered for Mounjaro as well.
Sure. Yeah. Yeah. It's interesting. One of the cool things that I have been pointing out here is that it's surprising, but 80% of the people 81% of the people on Wegovy are paying, I think it's less than $50 a month for Wegovy, like 81%. That's
when you're covered, you're really covered.
Right.
And that's why it's worth even that. That's why we built this free tool, because the variance is so massive and the impact is so significant that we're seeing probably about 45% of our patients covered. So again, still not the majority, but to your point, if 80% of them are paying less than $100, so you're having probably about 40% of people pay less than $100. That's less expensive than compounded. It's less expensive than branded. And so when you think about it, there's about 50 to 60 million people in the US that are covered for Wegovy. So there's tens of millions of people who should be able to get access to it. So as supply increases across, and probably similar for Zepbound, so as supply increases for these two, we hopefully, again, it's nowhere near where it needs to be in terms of coverage, but there is a significant amount, and bridging that gap again between knowledge, coverage, and access is really important for us.
Yeah, absolutely. Absolutely. When do you see, because obviously you probably saw this past week that of all people, the CEO of Eli Lilly called me before their earnings call to talk about the release the vials. And
not many people get that call.
No,
that's the OTP community right there.
I was 100% convinced.
I didn't get that call. You got that call. That's pretty great. That's pretty impressive.
That was a surreal. Let's talk about a surreal moment for sure.
That's very, very cool.
One of the things that probably people have asked me the most is, why didn't you ask him to lower the cost? like he would just be like, oh, I never thought of that.
Yeah, I've never thought about that.
Okay.
Dave, you're the first person to ever tell me that.
Yeah, right. Everybody else thinks it's super reasonably priced. So when do you see the price going down for both branded semaglutide and tirzepatide?
Yeah, it's tough. I think it'll be a little bit, unfortunately. I think where you'll see the most price competition is on the back end rebate and the formulary side. So you saw in Novo's Q1 earnings call, Novo's Q1 earnings call, you saw them lower the price that they were requiring from insurance companies for a few plans to get on the formulary. And I think that was driven by competition. And I think you're seeing right now, you're seeing Wegovy choke that early dose for maintenance, but you're seeing Lilly push even harder with the vials, right? So to ramp up supply even more. There's been a few reports that are showing, some of the a significant, I think a significant percentage, it might be the second most common reason that people start Zepbound is because they can't find Wegovy. And so when you see that, when pharma companies have that level of data, and they see historical data of what someone might have been on and what they're transferring to, those are the types of things that will kick people into gear, because normally you need a little bit more than an oligopoly, or you need a little bit more than two duopoly of two competitors to really see price competition. But I think what's interesting about this space is there's the formulary, which is that component of competition in addition to that. And then this supply competition is what's happening is you're seeing providers and practices sort of get in a groove of predictability, where if they can rely on a drug, if they can rely on its availability, then they'll default to it. And then that practice will typically build materials around it and build up a comfort with it. And so both from an insurance perspective and a supply perspective. So my hope is that right now that the shortage, Novo missed earnings, Lilly did not, obviously. So that kind of thing will create that competition. But I think it's going to be a significant amount of time before we see sort of that net price that insurance companies are paying be the list price. I think the Senate hearings will be interesting, but I think it'll take at least, I think, 2 to 3 years. I think a dark horse that is really exciting is Amgen. Amgen's drug, Meritide, the once a month injection that'll be out in a few years. The reason I think that is exciting is because they do have the manufacturing chops, right? They actually made Lilly's monoclonal antibody during COVID. They physically manufactured it. So they have a lot of manufacturing chops for large molecules. And so both needing a monthly, so they need a fourth of the supply, and having the history that they do, that I think that you're going to need one of them to come onto the scene. As you've said, a lot of these smaller companies, they won't necessarily have that supply and manufacturing capacity. They might not be able to get on the formulary. So there's a lot of other things in addition to just coming out with a great drug. So again, the sad part is I think it'll be a little bit, but my hope is that the price competition that we will see on sort of the back end side of the healthcare system will lead to more coverage faster. That's my hope, but I don't think we'll see that list price change for a little bit.
So let's talk a little bit about Meritide, because you think Meritide's a dark horse. People ask me about Meritide, and I'm like, I have a hard time getting excited about that one yet, because
interesting. Tell me
first
why.
of all, so like, I'm curious, you're probably way studied up on this. Like how much harder is a monoclonal antibody, carrier mechanism from a manufacturing standpoint, API standpoint? How much harder is that than a peptide? But then also, I feel like what they've gone with in Meritide is a GLP-1 or a GIP antagonist, right? Yep. And so in tirzepatide, you have a GLP-1, but it's a GIP agonist. Meritide is an antagonist. And the weird thing, they find either way, if you tinker with it, there's weight loss, right? But what it seems
people
like,
aren't sure exactly why as well, right? It might be like turning on, like the logic that has been explained to me in layman's terms, not like the logic, but a way to think about it would be like you turn up, you either are like turning on the power so much you break the fuse, or you're turning off the light switch, right? So you're either like, antagonizing, you're either shutting something off or turning it on so much that you turn it off. Potentially. Again, they're still trying to learn a little bit more here on the buttons, the hormonal buttons that they're pushing, and then sort of seeing the cascading impact. But that is one that is surprising people. In addition to, some of the glucagon receptors, that's surprising people given the role that it normally plays. So I think, we're learning a lot about the underlying, metabolic processes here through these drugs as well.
So Amgen didn't say much on their earnings call about Meritide.
Yeah.
And I'm just skeptical about it, because I feel like all they've really proven so far with the information that they've released is that it makes people really sick. They're stuck with that side effect for a month, and people do lose a lot of weight, but people get really sick on it, it seems like. So I'll be really interested to see that one, advance through phase 3, because I think they said they were even looking at like longer duration of space between the shots, like 3 months, 6 months. So that'll be a fascinating one to watch, but I think they have a lot to prove yet in terms of the tolerability of that one.
Yep, I think that's right. I think it's easier generally for them here. One, they tested multiple doses, like in multiple strengths, right? So again, it was a small trial. We'll see more and more data that comes out. So again, it's a little bit tough, but I think some of the things that are going for them are, from a business perspective on the manufacturing capacity, they have significant chops there. The second thing is, because it's monthly, they also need a fourth of the manufacturing capacity. And then I do think what you're seeing is some of the higher doses, they might have had those side effects. I do think that they will be, if they're seeing that long of a half-life, and something is effective or over a month and maybe even longer. So the tail after 90 days or even 5 months was really impressive in terms of the duration of the efficacy. And that could be a great thing for potentially either initially or for maintenance for people. If people, people might, I think that'll be an interesting tool.
Is that tail longer because the half-life's longer though? Don't you think?
Yeah. I mean, I think, if you think about the history, of GLP-1s, we've been trying to basically figure out how to make them more effective and take them less frequently. Right? Xenotide, when it first started, was twice a day. Then liraglutide was once a day. Then Wegovy and semaglutide once a week. Meritide maybe once a month. They're studying, different companies have different ones in the pipeline, 3 months, 6 months, potentially yearly. So again, it'll take time. But those are the things that I think are interesting, because it allows someone to catch up if they have a unique product like that.
Yeah. So would you say that Meritide is one that you're like, if you look at the landscape of like what the next 6 years of drugs that are coming out, would you say Meritide's top of your list?
I think it is. I think in terms of competition, it's up there, right? I think like Lilly's oral of Orpho and then their retatrutide. Lilly has, I think they're the 800-pound gorilla. They have the most compelling pipeline as well. Both in, so tirzepatide is obviously the more effective than semaglutide. I think Lilly's pipeline is the most impressive, but when I think about competition, I think those are the ones that give me, like Amgen is one that gives me a lot of excitement, because a lot of the other companies that are competing are much smaller. And so they'll either have to, get acquired, or if not, if they're going to go it alone, like, you've seen how long the largest pharmaceutical company in the entire world, how long it's taken them to ramp up supply. So it's not going to be easy. That's why I look to Amgen and some of those others.
Amgen, yeah, your point's well taken. Amgen has capacity and what'd you say, the chops to do it. I agree with that. Mm-hmm. I think if I were to pick one that I think is sort of the one that gets me the most excited, it's probably the Viking VK2735, the oral formulation, because you're always looking to get injectable results with an oral formulation. It sounds like it's very well tolerated, and the efficacy's there, and it sounds like they're just continuing to ramp up the dosage on VK2735 oral. Like, I don't know that Viking Therapeutics, I don't think they can probably.
Is it a small molecule or a large molecule?
No, it's a peptide.
Okay.
It's a GLP-GIP, and they have it both in an injectable peptide and the oral peptide. I don't know how I'm not sure how they've got the bioavailability dialed in on that. Obviously it's not very good with
on the oral one, you're saying?
Yeah, it's not very good with Rybelsus, but the weight loss is impressive. And like I said, because it's so well tolerated, it's probably my guess is, what I've found in my research is that that there's a ratio in tirzepatide of 5-to-1 GIP to GLP. So it's much more a GIP medication than it is GLP-1, which would explain GLP-1. Actually, the study came out a couple weeks ago that talks about how GLP-1 actually acts on a part of your brain that is responsible for like nausea, right? Where GIP presumably doesn't. And so that's why I think people tend to tolerate it well. And so I'm interested in what that ratio because I think if I had to guess that if they've really ramped up the GIP to GLP ratio, and because it's more tolerable, maybe I don't know. That'll be an interesting one to watch, because I think orals to me are what get me the most excited about the future of these medications, because if we can get to the point where you have a really solid option in an oral, it's so much more scalable. You can help so much more people than you can with these injectors, especially when you think about ex-US markets where, obesity
is cold chain and all of that. Yep.
Exactly.
There's the shipping, there's the manufacturing, there's the storage of it, right? You're even seeing, so there's so much that comes with a lot of these injectables. The interesting thing will be, can you, to your point, like, can you get right now what you said is like oral weight loss with, can you get similar weight loss results? Because I think that even as injectables get more and more effective, right? Retatrutide getting to 25, 30+%. But if we can get orals that are really tolerable at 15%, that can help a tremendous number of people, right? The only remaining, not the only, but one of the biggest questions there will just be the amount of API required, right? When you think about Rybelsus as an example, but you think about the OASIS trial with semaglutide, it was 25 milligrams and 50 milligrams of semaglutide. So on the 50 milligrams of semaglutide daily, that's 350 milligrams a week compared to 2.4. It's 145 times the amount of semaglutide needed. And so 145 times the amount, like, yes, the fill and finish of the pen has been one of the rate limiting factors for manufacturing, but and semaglutide, it is easier to scale up that ingredient than that entire auto injector mechanism, but that's a lot more. So it'll be interesting to see, can these companies get it with a manageable amount of API that they can scale up quickly as well.
And that is the $1 billion question, because they presumably were going to bring high dose Rybelsus to the market this year. Their last earnings call did not give me a lot of hope that we're going to see that, because it was earnings call one this year for Q1 was like, they had a slide deck. It sounded like we were going to get it around this time this year. This Q2 earnings call was kind of like, well, we'll see if it makes sense within our portfolio of medications. And they did touch on the API issue. It's definitely an API issue. I think that they're not bringing it to market, but you did see the efficacy with the high dose Rybelsus was getting up to Wegovy numbers. But
14, 15. The tolerability was like,
pretty close.
TBD. Yeah, but the efficacy was definitely there. And then the question is, like, can people ramp up a little bit more slowly? That's one of the things that I think is when people look at the dosing here, particularly with orals, it's easier with orals than an injectable there to personalize doses for patients, especially if it comes in tablet form, right? And so I think, like, if now, not everyone, but the majority of patients will need to be on this on an ongoing basis. And so as a result, there's where I've seen a lot of patients benefit is not rushing to get to the highest dose, right? Even at a typical titration schedule, if they slow it down and their body gets used to it over time, they can take more time to get to those higher doses, where ultimately they might see those same results. It might take a little bit longer, but it might be at a pace that they can tolerate over time.
Yeah. And we've had doctors on this show who have echoed exactly what you're saying. I mean, obviously the clinical trials, they're standardizing the titration schedule. But you've definitely heard from a lot of doctors who have a lot of patients on these medications who say, camp out on those doses, get the max benefit from each dose. Yeah. And Dr. Rosen used a really good, he said, climb the rungs of the ladder slowly, right? And so, obviously there's multiple benefits, but, the biggest one is if you get to where you need to be on a lower dose, that means you'll need a lower dose for maintenance, right? Yep. So always things to consider. Well, very interesting stuff, Z. I'm really excited about this tool that you guys have launched. I think it's going to be great for those who are, insurance is definitely, as you alluded to at the beginning of our conversation, one of those barriers for patients where it's so overwhelming. They don't always know what questions to ask to get the right information, because they may ask a couple questions and think they got the answer that they need, but they didn't maybe know exactly how to ask it. And so I love this tool for that reason, because you just, and there's a certain amount of people too who are just, they're never going to be adept at scrolling through their cumbersome insurance apps to try to navigate formularies. They're not very easy to use most of the time. So very exciting tool. Super excited that you all have such a focus on developing tools that are beneficial to the community. And I'm sure you've got other things that you're scheming up with your weekend warriors there. And I'm thrilled. Right. I'm thrilled to hear about maybe what those are in the future. But this is a really.
I'd love to jam on one with you. It'll be fun. Last thing, if anyone tries the tool and has any feedback, send it my way. But also, if anyone tries the tool and maybe they're not covered and they could use a little bit of help on the financial side. So if you use the tool and you send me an email, z@ro.co, I'll pop a couple $100 of credits in your account to make it easier to just get started to see if it's right for you. So if you use the tool and it would be helpful just for the OTP community, just shoot me an email, say OTP Thursday, just shoot me an email tomorrow or the next day and I'll add some credits there.
Wow. Very cool. Very generous of you. I really appreciate that, Z, and the whole community, I think, appreciates that. So very cool. Thank you so much for being here. Thank you for giving your time so generously to our community. Thank you to you and your entire Ro team for partnering us with us here at OnThePen. We couldn't be more excited to have you all here, and just super glad that our paths have crossed and we've been able to kind of work.
Big admirer of everything that you've done and what you've built, and it's just the beginning for OTP.
I really appreciate that. Likewise, the feeling's mutual. Z, have a great night. We'll do it again sometime soon.
See y'all soon. Thanks.
Take care. Z Reitano, you guys have got to take advantage of that. That was a very cool offer. If you missed that there at the end, make sure you rewind it, get the details there. The tracker tool was amazing. This insurance tool, really great one for those looking to just get started. I'm so excited. I don't know if we had any super chats tonight. I meant to say at the beginning, like we always do, that the biggest super chat of the night gets to choose where I inject this bad girl. I'm not sure we've had any, but that's okay because it could be just dealer's choice tonight. Really excited for this community. Lots of exciting things happening in terms of just the news, the press, the everything. It's just been an exciting few weeks here, and I'm so thankful to have done it with you all. I'm so thankful that you all have supported what we have done so well. Oh, Spoonie Megumi with a $20 super chat wants to get in at the last minute and choose where to inject it. You drop it. You let me know where I'm putting this bad girl tonight. But yeah, what an exciting couple of weeks. Make sure you check out the Fortune magazine. Really great article there. Make sure you check that out. What a surreal week that week was to have the Fortune magazine article drop, to have a conversation with Dave Ricks, CEO of Eli Lilly. That was Twilight Zone week. I mean, my head is still sort of spinning from it, but I really appreciate y'all being a part of that. Glad you could share that moment with me and my kids tonight too. That was a fun little moment. Really excited for the future here. Spoonie, you let me know where I'm putting this shot tonight. So you tell me where you'd like me to inject this. Really great stuff from Z. Really great stuff from the Ro team. Thank you to them for supporting what we do here at OnThePen. Really appreciate them. My personal journey, just to kind of give you all a little, the scale has continued to move down very slowly, but in the right direction. I think stress relief has a big part to do with that. Having some of the bandwidth freed up to do what we are doing here. Left lower belly. I'll do that. And so the stress reduction, more movement throughout the day, not sitting in a car all day, I think is a huge help. So I'm excited about that. So I'll give you a personal update here. We're going to inject into the belly here. All right. Thank you, Spoonie. Appreciate that. So yeah, VS just visited Ro. Super excited. Great service. Awesome. And Z said, if you drop him an email, z@ro.co, he'll make sure that he gets you some credits for using that tool. But very cool. Give him some feedback on that tool. Let him know what you think. I think it's an amazing tool. Ro's an amazing company. The people, listen, you all, I could have worked with a lot of companies along the way here, and I just felt like I was waiting for the right one. and got the opportunity to sit down with Z when they were developing their tracker tool, and just getting to know the guy. I was like, these are the ones. They're doing some really, really amazing things there at Ro, with a really patient-centric point of view. Like, obviously these tools, if they can connect you with Ro and you end up working with them, great. But that's not really their first angle. Their first angle is, how can we provide value to the community? Because they know that just, providing value to people is good business in general. But the tools that they have come up with are so uniquely helpful to this community. And so I was happy to share about these tools before I worked with Ro, and now I'm super thrilled to be working with them as a community advisor now for Ro. And so I get to share our perspective from the community with a company that genuinely cares. And so I'm super, super excited for that. Thank you for being here. What a great week this was. I appreciate you hanging out with me. Of course, we'll do this again next week. Super excited. If you haven't gone over to the blog, to the podcast, make sure you give that a 5-star rating and review. And this is what I meant to share. I meant to share this at the beginning of the show, so hopefully you've hung with me this long. iowapodcast.com. Let me look it up really quick. We have been nominated for a couple of podcast awards, and I'm going to link this in the description of the video. But if you go to iowapodcastawards.com/vote, they are taking votes. There's a little note at the top of the website that might give you the idea that they are not taking votes. They absolutely are. It's just that submissions to have your podcast included have ended. But basically what we are asking for you is to go to this website. I'm about to scroll it along the bottom of the screen here, and I will definitely link it in the description of the video also. But iowapodcastawards.com/vote. Scroll down till you see On the Pen, the weekly dose, and just vote for our podcast. That is the Viewers' Choice Award for the best podcast of the year in Iowa. Of course, that's where I hail from. Go Hawks. And we're nominated for a couple of other awards too that are not user voter based. But we would love it if you would cast your vote for On the Pen for the Viewers' Choice Award. So iowapodcastawards.com/vote and vote for On the Pen. That was the one thing I meant to share at the beginning of this video. Now that we've gotten that out of the way, may the Lord bless you and keep you, make his face shine upon you, and be so gracious to you this week. Thank you for being here. Really, really appreciate it. What a great interview with Z Reitano tonight. Always good to talk to him. And so I will look forward to being back here with you all next week. Until then, have a great week, and we'll catch you on the next one.